If you're taking tirzepatide and wondering whether you can add magnesium citrate, you're not alone. This is a common question, and while there's no official reason you can't take them together, there are some important things you need to know first. Before we dive in, remember that this video is for educational purposes only and isn't a substitute for personalized medical advice. Always speak with your healthcare provider before starting, stopping, or changing any medication or supplement. Let's start with the basics. Tirzepatide is a medication you might know by the brand names Mounjaro or Zepbound. It's FDA approved for type 2 diabetes and weight management. It works as a dual GIP and GLP-1 receptor agonist, which basically means it helps control blood sugar and appetite in several ways. One of the key things it does is slow down how quickly food moves through your stomach. This is called delayed gastric emptying, and it's actually part of how the medication works. Magnesium citrate is a bit different. It's an essential mineral your body needs for hundreds of processes, from energy production to muscle function to blood sugar control. When you take it as a supplement in normal amounts, you're just replenishing your magnesium levels. But here's where it gets interesting. In higher doses, magnesium citrate acts as a laxative. It pulls water into your intestines, which softens your stool and gets things moving. So you've got one medication that slows digestion down and another that can speed things up in your intestines. You can see where this might need some careful thought. Here's the good news. There's no official contraindication between these two. That means they're not medications that absolutely can't be taken together, but that doesn't mean you should just start taking them on your own without talking to your doctor first. Both of these affect your digestive system, and that's where things can get tricky. The most common side effects of tirzepatide are gastrointestinal. We're talking nausea, diarrhea, and sometimes constipation. These symptoms show up pretty frequently in clinical trials. Now, if you add magnesium citrate into the mix, especially at laxative doses, you could end up making those digestive issues worse. You might experience more diarrhea than you would with either one alone, or you could end up with unpredictable bowel patterns. Here's something else that's really important. Tirzepatide can affect how your body absorbs some oral medications. This includes birth control pills. If you're taking oral contraceptives or other oral medicines, you need to talk with your healthcare provider about whether you need to consider alternative methods or backup options. Don't make these decisions on your own. If you're thinking about adding magnesium citrate while taking tirzepatide, here's what you need to discuss with your healthcare provider. First, talk about why you want to take magnesium. Are you addressing a deficiency that showed up on lab work? Are you dealing with constipation from tirzepatide? Your reason matters because it affects whether magnesium is the right choice and how you should approach it. Only use magnesium under the guidance of your healthcare provider, who can determine if it's appropriate for you and how to take it safely. Don't start, stop, or adjust magnesium or tirzepatide without your clinician's guidance. They know your complete medical history and can give you personalized recommendations. If timing is a concern, ask your healthcare provider or pharmacist about the best way to schedule your medications. They can help you figure out an approach that makes sense for your specific situation. It's also worth discussing your overall digestive health with your doctor. If you're already experiencing significant nausea, diarrhea, or other gastrointestinal symptoms from tirzepatide, adding magnesium citrate might not be the best move right now. Your healthcare provider might suggest addressing those symptoms first or finding an alternative approach. Now let's talk about safety and when you absolutely need to reach out to your doctor. Certain situations require extra caution. If you have kidney disease, you need to be particularly careful with magnesium supplements. Your kidneys filter out excess magnesium, and if they're not working properly, magnesium can build up to dangerous levels. If you're experiencing severe gastrointestinal symptoms, whether that's persistent diarrhea, severe nausea, or vomiting, contact your healthcare provider right away. Severe diarrhea can lead to dehydration and electrolyte imbalances, which can be serious. Speaking of dehydration, if you're already dehydrated, adding magnesium citrate could make things worse. Signs of dehydration include excessive thirst, dark urine, dizziness, and dry mouth. If you're experiencing these, talk to your doctor before taking any laxatives or supplements. It's also important to remember that tirzepatide carries an FDA-boxed warning for thyroid C-cell tumors. It's contraindicated if you have a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. This is something your doctor would have discussed with you before prescribing tirzepatide, but it's worth keeping in mind as part of the overall safety picture. So let's recap the key points. Magnesium citrate can generally be taken with tirzepatide since there's no official contraindication. But you need to be cautious because both affect your digestive system and tirzepatide can affect how some oral medicines are absorbed. Never start magnesium or adjust your medications without talking to your healthcare provider first. They can help you determine if it's right for you and create a safe plan. And certain conditions like kidney disease, severe GI symptoms, or dehydration mean you absolutely need medical guidance before combining these medications. Remember, this information is educational and not a substitute for personalized medical advice. Your healthcare provider knows your complete medical history and can give you guidance tailored to your specific situation. If you found this helpful, hit that like button and subscribe for more evidence-based health information. And if you have questions or experiences to share, drop a comment below, but please don't share specific doses or regimens. Thanks for watching, and remember to always consult your healthcare professional before making any changes to your medications or supplements.